Good morning. My name is Aditya Nayak, and my today's topic is cranial nerves 1, 2, 3, and 4. So, what are actually cranial nerves? Cranial nerves are a set of 12 pairs of nerves that emerge directly from the brain, mainly from the brainstem and the forebrain. So, there are 12 pairs of cranial nerves, and those cranial nerves I am going to enlist it. Those are the olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, spinal accessory, and hypoglossal nerve. So we are going to see the first four, that is the oculomotor, the first four, that is olfactory, optic, oculomotor, and trochlear. So let's start with the olfactory nerve. Olfactory nerve originates from the cerebral hemisphere. Its innervation is nasal mucous membrane. Function is sense of smell, and dysfunction is anosmia, that is loss of sense of smell. Clinical evaluation is by using familiar substances, that is coffee, lemon, garlic, etc. And we test each nostril separately. If you want to test the right nostril, then you have to close the left one and just ask the patient to smell some type of familiar substances, not toxic ones. If you want, not toxic ones, just the familiar one. Okay, like coffee, lemon, garlic, like that. Um, let's see that in this video.
Have you noticed any changes in your smell or your taste at all recently?
No.
Okay, I'd like to go ahead and just test that if that's okay. So could you block your right nostril for me?
Scratch cards can be used to test the sense of smell. However, familiar scented objects such as citrus fruit or coffee may also be used.
Can you tell me what this odor most smells like?
Onion.
Okay.
Avoid using noxious smells such as ammonia, as this may irritate the nasal mucosa and stimulate the trigeminal nerve.
Okay, let's block the other nostril now.
Repeat this test on the other side to test the contralateral cranial nerve.
Second is optic nerve. Optic nerve originates from the retina of the eye. Its innervation is lateral geniculate nucleus of thalamus. Function is vision. Dysfunction is blood vision, complete blindness, hemianopia. Hemianopia means loss, only you can see only half of the vision. Half of the vision is only available. Ipsilateral visual loss means which side nerve is affected, that side vision will be lost. If right side nerve is affected, the right side vision loss will be there. That is ipsilateral visual loss. Clinical evaluation is by visual acuity test, that is by using Snell's chart for distant vision, and visual field test by confrontation. Now you have to ask the patient if you can see, like if you can see your finger or not. You have to test each eye separately by closing the opposite eye. This is the Snell's chart, and you have to keep this at a distance of you have to keep this at a certain distance and ask the patient to read the letters till how much the patient can read. Okay, and you can understand how much vision is there or not. Third is oculomotor nerve. Oculomotor nerve originates from the midbrain. Innervation is extraocular muscles of eyelid and sphincter and iris. Function is eye movements, that is inward, upward, downward, and outward. Pupil constriction, shape and equality, elevates upper eyelid like this. Accommodation reflex. Dysfunction is ptosis. Ptosis means you cannot elevate the upper eyelid. Disconjugate gaze means you're unable to move the eye up, down, outward, inward. That is. Then pupil dilatation, bilateral or ipsilateral pupil dilatation. Then loss of accommodation reflex. Okay, these are the dysfunction. Clinical evaluation is by observe for eye opening and symmetry. You have to observe if the eye opens. Eye symmetry means the pupil shape. You have to check. Direct light response, which can be brisk, sluggish, or non-reactive. Consensual response, present or absent. You have to check all these. Direct light response means if I am placing a light on the eye, on the right side of the eye, and if the right side pupil constricts, that is direct light response, and if the left side eye constricts along with the right eye, that is the consensual response. Means the opposite eye is also getting constricted, right? So that is opposite consensual response. Fourth is trochlear nerve. Trochlear nerve originates from the midbrain. Its innervation is superior oblique muscle. Function is downward and inward movement of eye. Dysfunction is loss of downward and inward movement of eye. Down and inward movement. Okay, down and inward movement. Clinical evaluation is extraocular movements. Extraocular movements, that is downward and inward movement, will be lost. Okay. Now, clinical evaluation by extraocular movements, that is, you have to check the upward, downward, those movements. Usually, cranial nerve 4 and cranial nerve 3 are tested together because 3 also considers the upward, downward, inward movement also. So, together they are tested.
So we are going to check the oculomotor nerve. So for first, I'm going to check the the consensual light response and the light response. So I have my flashlight right now, and we are going to check the pupil constriction. Now I can see pupil constriction in his eyes, so his oculomotor nerve is not affected. And for checking the ocular movements, I'm going to place my finger and I'm going to tell the patient to focus his eyes on my finger and to move his eyes according to my finger. So for checking trochlear nerve, for checking the trochlear movements, I'm going to take my finger inward and downward. As you can see, his pupil moves along with my finger, so both the nerves are not affected.
Reference is Physical Rehabilitation by Susan B. O'Sullivan. Thank you and have a nice day.